And thank you, Katia. Well, we're back here on Open. The U.S. Centers for Disease Control and Prevention has concluded that the mosquito-borne Zika virus is a cause of fetal microcephaly and other severe abnormalities. Now, this is based on an evaluation of data encompassing the current outbreaks in Brazil, as well as Colombia, as well as in France, Polynesia in 2013-2014. Here now to tell us more about the Zika virus and how we can protect ourselves is epidemiologist and Mercy College professor Dr. Rossi A. Hassad. We welcome him back to the show. And Dr. Hassad, good to have you.
Thank you.
As we are looking here in the summer, of course, we know a lot of people are concerned about Zika. We hear a lot of things, especially here in the media, talking about cases of Zika virus. But let's assume that our audience really knows not too much yet. Let's break down first and foremost, what is the Zika virus?
The Zika virus is a virus, but it's linked to the Zika virus disease. And the Zika virus disease is caused by infection from the Zika virus. Mm-hmm. The Zika virus is a mosquito-borne virus. Primarily, infections are brought about by transmission of the virus through a mosquito. That's not to say it can't be transmitted otherwise, such as by sexual contact. Rarely, it could be by blood transfusion, but primarily the Aedes aegypti mosquito species, which is responsible for transmitting that virus.
Now, we hear a lot about the mosquitoes that come from over the Caribbean or across seas. Who is most susceptible to receiving the Zika virus?
Well, in terms of who is susceptible or at risk, we have to look at how you can become infected. So if you think that bitten by a mosquito, so anyone who can come in contact with the mosquitoes would be at risk. You can become infected. The fetus, the developing fetus, is most at risk. So a mother who is infected can pass the virus on to her baby, and that's the biggest concern surrounding the Zika virus. And then you can become infected through sexual intercourse, be it oral, anal, or vaginal. And then you have the rare occurrence, in theory, and that is by blood transfusion.
Mm-hmm. When we talk about New York and specifically the borough of the Bronx, what are we seeing, what are we hearing, what do you know?
I often say, if you must get ill, New York City is a place to be. The risk of infection in New York City, in particular, is low to zero. You probably would have heard that we do have quite a few cases in New York, but we don't have the mosquito to transmit the virus from the infected people to others. All the cases in New York City are travel-related, meaning people who travel to countries where there's active transmission of the virus and brought it back to the country. So, I mean, I've been in contact with the Department of Health, Dr. Mary Bassett and her team, and I know that there's a comprehensive plan that has been rolled out regarding health education, screening, mosquito control and prevention. So we are relatively safe, and again, the risk is low to zero. We do not have the mosquito that is primarily responsible for transmitting the virus from an infected person to someone else.
And you talk about active transmissions, and they're not really here in the United States. Where are some of those places? Because we're hearing even in the sports world, athletes saying they refuse to travel to certain places. Mm-hmm. Actors talking about they won't film movies in certain places based on the fact of Zika being a realistic threat.
The place you would have heard most about is Brazil. Has the highest number of infections and cases of microcephaly. But right around us in Puerto Rico, there is it's spinning out of control in terms of number of cases. Dominican Republic comes next in terms of the number of cases that we are seeing here in New York City, and then Guyana. So if you look at the order of contribution to the numbers we have in the city, the highest proportion from Puerto Rico, then Dominican Republic, followed by Guyana. Mm-hmm. But again, as we say, this should not be used to profile or label any particular group.
Mm-hmm. We hear about the virus. Talk to us about treatment and what goes on from there.
There is no vaccine, meaning there's no way that you can inoculate yourself to prevent the infection. So there's no vaccine, nor is there a specific treatment. When it comes to Zika, the symptoms are usually mild. It's like a mild flu with an occasional rash or red eye. 80% of the people who become infected may never know. It's a very benign disease. And the treatment is usually the symptoms. You treat the symptoms. You treat the pain, the malaise, and keep the patient comfortable. And in most cases, it will subside within 2 to 7 days.
Mm-hmm. So for people who want more information about Zika, what do they do?
Well, there are many places. There's active work going on in New York City, the New York City Department of Health. There's also a dedicated information line. I don't have the number here, but we can get that later. There is the New York State Department of Health. There's a dedicated website. At the national level, we can go to the Centers for Disease Control and Prevention.
And you also had some information listed at the bottom of your screen that you can find out a little bit more about that. We'll throw that up one more time just so you can have the opportunity to see if you want to know a little bit more about the Zika virus. And we've been here with Dr. Rossi Hassad, who is an epidemiologist and also professor at Mercy College, giving us the latest updates. So the places to really to talk about high concentrations of numbers of Zika is Puerto Rico, Dominican Republic, Guyana. But once again, here in the United States, New York, not a real worry.
No, we do not have the mosquito to spread the virus from the infected person to someone else. All cases here are travel related.
I wanted you to say that twice so that way our viewers can relax a little bit. All righty, Dr. Rossi Hassad, thank you so much for coming and sharing with us.
Thank you.